Good morning to you.
Good morning to you, sir.
And welcome to the Big Brother diary room.
Big Brother?
Yes. Oh, more so, Big Sister.
I don't watch Big Brother. Shut up. Welcome, hi.
Hiya.
We're on television.
I can see you, but you can't see me. It'd be really useful for you to say again what you think about the National Health Service. Do you think it's good or do you think it's bad?
I think it's absolutely brilliant.
Well, I'd like to say how brilliant it is.
I think the hospitals are very clean and very tidy, and I think the staff are lovely.
I can't grumble at all, love.
Why's that?
Because I've been waiting on hand and foot every time I've been in.
I just think it's management who are ruining it all.
Are there any of those topic areas, such as services for young people, GP services, dental services, etc., that you would like to comment upon and you'd like to see improve for yourself and your family?
Well, the main thing is the dentists.
The dental care. I think they need more dentists about. I think. Yes, so do I.
Very necessary that one. GP.
There's not enough GPs.
Okay, the only thing that they need to, just improve on is, get more GPs, so that they can attend to patients, as fast as possible.
If you want to make an appointment, you've got to ring. I think the surgery's open at 8:30. Before 9 o'clock, and the phone lines are constantly engaged.
If you do ring up for a doctor's appointment, for the morning, they won't see you. They give you an appointment for weeks afterwards. And that's no good, because how do you know you're going to be poorly in 4 weeks' time?
Because I think people get really stressed about the doctors and appointments and things, and then they feel like they can't do anything, that they might maybe complain to the doctor and nothing gets done. So I think overall there's probably stress about it more than anything.
If I go to see a doctor or a dentist, it's just basically they start looking at the clock as soon as you walk in the door, and it's a little bit off-putting. I remember the times when doctors used to, they knew who you were, they knew your name, they knew your family, they knew your history, and now it's a case of get you in and out of the door.
Oh, is he going to be in Saturday as well?
Yeah, that's what's being suggested. Would you?
That's a nice suggestion, that.
Yeah, be in favour of that?
Yeah.
So extended opening hours is something that you would certainly welcome. Before coming here today, were you aware of the PCT and the services that it actually provides to the community?
No, not really.
Yes.
No, to be honest, I wasn't.
No, not at all.
No.
What about helping you to lead a healthier lifestyle?
Probably if they had more nurses on, for advice on diet and healthy eating.
Well, if you're walking around town, it's all kebab houses and chippies and that. So
well, that's an interesting comment, actually. So you feel the
environment's more.
The environment itself, in terms of the eateries that are out there, are not exactly conducive to encouraging healthy eating.
I think there is a lot more people that want a healthy eat, but I think there's a lot of people that can't be arsed, so to speak, to go down to the GP or can't be arsed to go to a clinic. They just, they've got such busy lifestyles. They go to work, get the kids to school, come home, cook the dinner, get ready for bed, and then get them into bed and then chill out.
I think it should be cheaper to eat healthily, but the way it is, you pay more for a smoothie or sushi than you will for a bottle of Coke.
So is it actually better street cred then if you're fat?
Sort of. If you eat fatty stuff, then yeah.
There's more street cred around, though, is there? Yeah. Rather than having a nice bowl of fruit or something.
Yeah, if you got caught eating a bowl of fruit, I think you get a bit of stick for it around here.
I think with obesity, I think it should come down to neglect, especially in young children.
People underestimate how much damage it can do, and it really can make you so ill.
There's another problem about obesity, about people being fat. What do you think we should do? So, and it's increasing in young people.
Close down Mackey's.
The parents should stop letting the children have takeaways and unhealthy food.
Handcuffed them to a treadmill.
More activities for mothers and kids to get into to keep their kids healthy, plus us healthy. Well, I think they should do more free stuff for people who maybe can't afford to go to the gyms and all that.
Yeah. Buy them a leisure pass.
Yeah, leisure passes, free leisure passes, so that way they'd be more ready, willing to go to the gym rather than spend loads of money.
Cheaper gyms.
Cheaper gyms?
Gyms are £26 a month when people can't afford to pay it. Okay. They're not going to go to them.
I think if GPs had a closer link to health clubs, health centres, that kind of stuff, you know, fitness gyms, maybe to dietitians, and basically rather than just write out some pills or liquids or medicines in general, to actually make suggestions as well as to what a person can do to improve their diet, maybe recommend them to somebody in the community.
Do you think that young people have any major health problems?
No, not really.
No, I don't think so.
I can't think. Don't know, no.
Well, apparently one major problem is smoking.
Oh yeah.
And they want to stop people smoking. Do you think that's a good idea?
Yeah, no, because I smoke.
Well, I smoke myself, so I don't know.
Well, really, it's up to them, really, if they want to stop smoking, isn't it, really? We can't say not smoking.
But say if somebody said, right, I want to stop smoking.
Yeah, I say that every day.
You don't notice, like, how bad it is, because, like, your parents do it and, like, people you know do it, so...
But you're fully aware of the consequences of smoking?
Yeah.
I presume you don't want a chance of going blind or having heart disease or dying of lung cancer?
Wow, can you go blind off smoking?
Huh?
Can you go blind off smoking?
Yeah. Yeah. If you get diabetes, which smoking is you're prone to.
Is it diabetes?
Yeah, smoking can give you diabetes, yeah. What do you think we can do to get young people who are smoking too much to not?
Show them what it does to you.
Just think better awareness of what nicotine can actually do to you.
Yeah.
I think that we've had the adverts that were sort of banned because he went too far. Well, personally, I lost my mother and my father to nicotine-related death. And I think that they're not hard enough.
They've started in one good thing by getting rid of smoking in pubs and restaurants.
Another major problem is about binge drinking.
Oh yeah.
Alcohol's a major problem. That's what I was talking to the volunteer about as well. What really annoyed me as well was this guy who lives here, Alan Hansen, I think his name is.
Oh, Alan Hansen, yeah.
He advertises for Morrison's.
Yes.
And they're advertising at £11 a litre. A litre for alcohol, whether it's gin or whiskey or whatever.
So you think role models like Alan Hansen shouldn't be doing that?
Exactly.
And I think if they showed people dying of liver disease and cirrhosis of the liver and everything else, then I think that would actually put people off, because it's a dreadful way to die. Slow, painful death.
What about drugs? Do you think we should encourage people to start taking drugs?
Yeah.
Why?
Because bagheads, I hate them all.
I know, yeah, smackheads should be lined up against the wall and shot.
What would be the youngest person that you know of smoking
How old is he?
cannabis?
7.
7 years of age.
Yeah.
And how does that young person of 7 get hold of?
He picks stints up out of his mum's ashtray. His family smokes it as well, so he can get it off his cousins and stuff.
And there's housekeeping. I want to know. I thought you dealt with me very well, considering everyone's under a lot of pressure, because I'd just done my hamstring, and that was brilliant. But when I said to the woman, "Do you want my boot back?" and she said no. Well, I don't know how much this boot costs, but all I know is all you have to do is wash the sleeve, and it's usable again. So you're wasting money. So how many other things are you wasting money on?
I deal more with health visitors than I do doctors or anything like that, and special clinics. And I think they're brilliant, to have a special clinic designed for children.
But what you just said before is that you think we should target the children, yeah?
Oh, yeah. You must. If you fail them, you fail society.
This is kind of just a compliment kind of thing, but I think even though the hospitals aren't so what some people are like, I think I like the way the NHS has kind of moved out and done more practical stuff. Like, we've got NHS people, we've got an NHS nurse who comes into our school and things like that. So I like the way now it's easier to access and there's more down-to-earth things and more things which people can use rather than just a hospital.
Is there anything else that you're an issue that you're burning to say?
No, that's all I wanted to say, just really to fully back the National Health in everything they do. They've been absolutely wonderful in my case.
Well, thank you for that, because I'm sure you know we get a lot of people in being quite critical, so it's really nice to have somebody coming in who's being quite positive and praising.
As I say, I've had my money's worth out, and hopefully they've made me better.